Hi everybody, this is Dr. Ihab Abdulrahman Ihab Tarawa, consultant of acute care medicine at Soba University Hospital, professor of medicine, University of Khartoum, dean of Sama Institute of Health. This is the first session in our series about patient safety. This is topic 1. What is patient safety? The learning objectives of this session to describe causes of errors and medical errors, discuss the burden of medical errors, define the discipline of patient safety and its role in minimizing the incidence and impact of adverse events, and also we would like to describe lessons learned from other industries. Let us start with a case scenario. Hajja Maryam, a grandmother, she worked to support her family. She tripped and had a fall. She was able to get up and walk. She reported pain in her shoulder. Her grandson took her to the emergency room. There, she was seen by a medical officer who examined her and did an x ray. He reviewed the film. He concluded that the film was normal, and he reassured Hajja Maryam and her family that there was no fracture, and he diagnosed her as shoulder sprain, and he advised her to come for a follow-up in 1 week at the orthopedics clinic. So she remained symptomatic in spite of taking pain medication. She was increasingly uncomfortable, and at 1 week follow-up, when she came to the orthopedic clinic, she was seen by a registrar, and he examined her, but he was not able to locate the X-ray, and he concluded that it was shoulder sprain, and he asked you to bring the X-ray film in 2 weeks. And he reassured Hajja Maryam, confirming that her pain level is normal with her age and the extent of the fall. Anyhow, she remained symptomatic, and 3 days later, her symptoms were worsening. There was growing concern, and grandson took her to the emergency room. In the ER, the resident diagnosed her with shoulder impingement and referred her to physiotherapy. The grandson requested the emergency room resident to review the X-ray done 2 weeks earlier, but the resident was not able to locate the film, and he asked them to contact the radiology department, and they take the report with their follow-up at the orthopedic clinic, and he gives them pain medication and refers them for physiotherapy. Physiotherapy started, but the physiotherapist was concerned that there was no improvement. In fact, she was worsening. And he asked them if they ever did an X-ray, and he learned that X-ray was done at the initial visit and it was never reviewed. The grandson went to the X-ray department and he got the report. Unfortunately, she had shoulder dislocation. So after radiology reviewed the film, your grandmother having shoulder dislocation, and she has seen an orthopedic surgeon who scheduled her for an immediate surgery. Before starting the procedure, the surgeon talked with you and your grandmom and explained that she might suffer permanent loss of function because the diagnosis was delayed. So let us reflect on this case. What are the factors led to delayed diagnosis? Why the X-ray film was not reported? And was there any hospital policy to review emergency room X-ray done in the emergency room immediately? What about the communication between these different providers? Do you feel that as a family member your concern was addressed? The reality is that studies have shown 1 in 3 Americans have experienced medical error in their own or family members. So during their lifespan, 1 in 3 experience medical errors. So, for you as an individual, as a patient, whenever you enter a healthcare organization or institute to receive medical attention, you become patient of that institute. And you become dependent on the performance of people in that organization and on the culture and attitude of the provider there. But you want to be treated, you want to have adequate diagnosis of your problem, you need them to provide effective and appropriate treatment and to ensure your safety and to communicate to you and to address your concern. According to WHO, patient safety is the absence of preventable harm to patient during the process of healthcare. A focus on safety can also reduce the severity of harm should it occur. For a long time, people used to believe that getting injury or harm during the process of care is the cost you pay because receiving medical care. In early 1990s, there is a study from Harvard study pointing to the prevalence of medical error and unsafe practice. But the landmark study, it was in 1990s, the Institute of Medicine released its report to err is human, which call for a swift reduction of medical error in United States. They reported that between 44,000 to 98,000 people died each year in United States hospital due to medical errors. That was more than the number of people who died in a given year from motor vehicle accident, breast cancer, and AIDS. The media put this in a graphic way, and media turns this statistic into startling headline: medical mistake number 8 killer. This is was in 1990. Now it is the third. It is the third killer. The New York Times article reported commercial airline travel become so reliable that even if you flew every day, it will take you an average of 123,000 years to die in an air crash. But 1 in 10 or 10% of people admitted to acute care hospital, they die or suffer significant injury. According to the global state of patient safety, the magnitude of the problem, unsafe care is one of the top 10 leading causes of death in the world. Up to 83% of these error and injury are avoidable and preventable. 1 in 4, 25% of patients attending primary care clinic, it is estimated that these patients are harmed. And if you look at hospitalization in 2013, over 420 million hospitalization happened in that year. 43 million has suffered from adverse event. Interestingly, 75% of those harm happen in low and middle income countries. High mortality, poor quality of care account for 10 to 15% of total deaths in low and middle income countries. Um, of more than 130 million births occurring each year, 2.6 million result in stillbirths and another 2.7 million result in newborn deaths within the first 4 weeks of birth. Every day, 830 women die from preventable causes related to pregnancy and childbirth. Frontline maternity staff in United Kingdom demonstrated that 600 of the frontline maternity staff in United Kingdom demonstrate that palpable concern for safety. The economic burden is huge. In United States alone, the economic cost of unsafe care has been estimated to be 1 trillion. So if you put it to the global cost, it will be multi-trillions. The direct cost associated with test, treatment, and care required following harm in the primary and ambulatory setting is estimated to be 2.5% of the total health expenditure. Medication errors alone across the world account for 42 billion annually. Harm often result in hospitalization, accounting for 6% of hospital beds and more than 7 million admissions. In the US, where investment have been made to improve safety, it is estimated that 28 billion will be saved over 5 years. The annual cost of common adverse event in United Kingdom is equivalent to hiring 2,000 general practitioners, 3,500 hospital nurses. Estimates suggest that in developed in developed countries, the cost of harm in primary and ambulatory care can approach 3% of GPD. National Health Service maternity service claim uh, relating to medical negligence amount to 2.1 billion. We are going to continue in another session, but we conclude here. Take home medical errors are common, and safe care will lead to significant patient harm. 10 to 15% of hospitalized patients are injured during the process of care. Economic burden is huge and tremendous, and thank you.